These are some of the tests of examination of posterior instability. You can have the patient lying down to stabilise the scapula, but I actually prefer to have the patient sitting up. I like to sit on the bench beside them with a chair with no particular arm. So the first thing we're going to look at the anterior and posterior draw. So it's important to stabilise the scapula, so I've got my hand on the acromion at the back and the coracoid at the front to completely stabilise the scapula. I've then got the humeral head, and what I'm going to do is I'm going to try and push it forwards to see if there's any glide and play, and then push it backwards. What I'm really feeling for is glide and translation. 25% is probably normal, 50% is getting to the rim, and a grade 3 is 100%. We're also looking for some pain and discomfort. A similar test, but a different name, is the load and shift. So you're really doing exactly the same thing, stabilising the scapula again. So now we're going to actually put some axial load on the head. And what I'm really asking Ed to see if he's got any pain or discomfort or a click at all as I bring the head back posteriorly, bring it back anteriorly. Ed's shoulder's pretty stable and there's no obvious discomfort there. Next test is to look for posterior apprehension. In this position I'm going to stand in front of Ed and I'm going to get him to elevate his arm up into the neutral position and drop him slightly into internal rotation, some cross-body adduction. I'm going to put my hand on the back of the scapula to partly stabilise the scapula and feel the humeral head. I'm then going to put an axial load directly onto the humerus, and what really feeling for is any apprehension or discomfort or pain from Ed, or if I can feel his head glide backwards. In Ed's case, he's fairly stable. This one is the jerks test. So in the jerks test, I'm going to bring his arm round to 90 degrees in elevation with some slight internal rotation. Once again, I'm going to put an axial load, and then I'm going to bring his arm across in adduction. So this, if there is any pathology, will push the head posteriorly. You may get a click or jerk, hence the name, the jerks test. Once again, nothing positive in Ed's shoulder. The last test is the Kim's test, looking for posterior labral pathology. In this position, you have the arm up again at 90 degrees, with a little bit of a neutral position. I'm going to have my left arm actually pulling back on the humerus. My right arm is actually going to directly load, so I'm loading his humerus with axial compression. I'm pulling back, and then as I bring his arm up to 45 degrees, we're going to see whether the humeral head's going to glide off posteriorly. If he gets a pain or clunk there, that's suggestive of some posterior labral pathology or posterior instability.